Hi, occupational therapy students. Today I'm going to show you how to get every question right with 6 simple steps. Simply fill in the blanks or write it down on your whiteboard. And remember the mnemonic, read with diligence and patience before answering. So today's question, we're going to start by reading the question very carefully. And the question is, a CODA is working with a 73-year-old patient who lives alone in an apartment on the management of his medication. He has been diagnosed with diabetes mellitus 2 and is therefore at risk for developing peripheral neuropathy. While observing the patient retrieving his medication from the upper cabinet, the CODA observes certain behaviors that may be consistent with early symptoms of a peripheral neuropathy. What observations has a CODA noted that would most likely require her to report a change in the patient's status? And we need to choose the best 3 answers. So step 2, where is the question at in the OT process? It's in the intervention phase. It's in the intervention. Step 3, what is the disease or diagnosis? Well, it's diabetes mellitus 2. It's not progressive, and it can be controlled by lifestyle changes and with medication. And due to the nature of the disease, the patient is at risk for developing a peripheral neuropathy. In step 4, we want to understand the problem. So what is the patient's problem? What is the patient's level of performance or function? And what symptoms are they experiencing? So while observing the patient retrieving his medication from the upper cabinet, the CODA observes certain behaviors that may be consistent with early symptoms of peripheral neuropathy. So in step 5, what is in bold or in caps, we really want to pay attention to what is the question specifically asking. So what's in bold, caps, or what's really essential to this question. And we need to observe most likely 3 indications, early symptoms of peripheral neuropathy. So now let's get to the answer choices. The answer choices are A, difficulty reading the medication bottle label, B, problems with coordination and proprioception while walking, C, dropping bottles in attempts to transport them to the table, D, shaking his hands when trying to open a child-resistant medication bottle, E, loss of forearm supination to stabilize the pills in his palm, F, diminished ability to swallow without coughing. So now we're going to get to the answer choices that we know are incorrect, so such as A. A is incorrect because peripheral neuropathy is not expected to cause visual problems, so we're going to cross that out. E is incorrect as well because loss of forearm supination is not expected. F is incorrect because swallowing is not affected by peripheral neuropathy. So now we know the correct answers are B, C, and D. B is problems with coordination and proprioception while walking. C, dropping bottles in attempts to transport them to the table. D, shaking his hands when trying to open a child-resistance medication bottle. So we know that problems with coordination and proprioception while walking, dropping bottles in attempts to transport them to the table, and shaking his hands after trying to open a child-resistance medication bottle. Peripheral neuropathy is a condition affecting the nerve fibers responsible for allowing signals to flow from the brain and spinal cord to other parts of the body. Sensory, motor, or autonomic functions or a combination are affected. Vibration and position sense, sensitivity to temperature, numbness and tingling, abnormal sensorimotor functions, and pain to light touch, which would normally be painless. Also, I wanted to let you know that PASS OT offers the most effective and affordable study prep for the MBCOT exam. Since launching in June of 2013, our course for the MBCOT exam and one-on-one personal tutoring via Skype or phone has helped over 2,000 students pass the OT test. We do look forward to helping you pass as well. Have a great day. Bye-bye.